Hello viewers, I'm Dr. Pankaj Walecha and today we will talk about moderate osteoarthritis. In our previous video, we have told you about mild osteoarthritis and strategies to prevent the further progression to moderate osteoarthritis. But what if a patient comes to us with moderate osteoarthritis? Now these patients have developed deep erosions in their cartilage. Now as we told you in the previous videos about the cartilage, this cartilage develops deep erosions. In the mild stage, they are superficial. Now they start getting deep. Once the erosions are deep, they lead to friction in the knee joint, and which leads to development of swelling in the knee in the form of a fluid. The fluid which forms in the knee because of arthritic process is not like the natural joint fluid. It is poor in hyaluronic acid content. It has less viscosity, less elasticity. Also, the subchondral bone, by which I mean the bone which is right underneath the cartilage. So this is the cartilage surface, and the bone right under the cartilage is called the subchondral bone. Now this bone is very, very important in providing nutrition to the cartilage. As the cartilage is wearing out, the subchondral bone starts getting exposed, and that is what leads to a condition which we call moderate osteoarthritis. How do you identify a patient with moderate osteoarthritis? The pain has increased, the swelling is increased, and the painful crepitus is there. In fact, these patients have pain even while moving their knee joint in a lying down position. We typically see such patients coming to our clinic with a limp. They have painful limp, they find it difficult to sit and stand from a chair, and usually their activities of daily living are restricted. In the management part, we usually clinically examine the patient and see if the patient has any obvious deformity. We check whether the deformity is correctable or non-correctable. On the basis of that, we order an investigation called orthoscanogram, which gives me the alignment of the whole limb. It is very important to know the alignment, because if the alignment is not correct, then your knee joint will wear off faster. It's just like if the alignment of your car is not proper, then there is faster wear and tear of the tires of the car. So if your limb alignment is not proper, then your knee joint cartilage erodes faster. So now let's talk about the management strategies of a patient with a moderate osteoarthritis of knee. We must tell you that knee exercises, weight reduction, supplements for the cartilage, and physiotherapy. All these are our first line of treatment. We offer it to all our patients, and a lot of patients get improvement in their symptoms just by that. But there are a subset of patients who need further investigations, as we told you about an alignment X-ray. So we categorize our patients into two categories: one whose alignment is correct but who are not improving with physio and exercises, and two, patients who have malalignment. So now the patients with the correct alignment, they are offered viscosupplementation. What do we understand by that? It is injecting a fluid which is similar to your knee joint fluid, and it improves the environment of the joint space so that the cartilage can heal. But those patients who have malalignment, which means that they have deformity which is similar to bow legs or knock knees, they usually require a surgical correction, because their knee, the subchondral bone, has started to erode, and the proximal part, the upper part of the leg, has started to develop a deformity, which means the bone shape starts changing. Now in this alignment correction surgery, we cut that bent part of the bone and correct the alignment of the leg. This is called a joint preservation surgery, by which we mean that it adds years of life to your natural knee joint. It restricts the progression of the arthritis from moderate to severe. So it is a knee joint preservation surgery or an alignment correction surgery. It is very, very helpful to treat those patients with moderate arthritis who have malalignment along with the arthritis. In our next video, we'll talk to you about the stage 4 of arthritis and how do we treat it. Thank you very much.